My name is Larissa Barraza, and I will be talking to you about child sexual abuse and maltreatment for today. So some of my objectives that I have for you all is after this lesson, you will be able to identify 5 different types of abuse. You would be identify how each type of abuse affects the child, signs of child abuse, how to communicate properly with the victim, learn how to report abuse, learn what SANE examination is and what it is that it stands for, along with treatments. Some of the most important things for you guys to learn from this presentation is to make these topics easier for you to comprehend, and of course, targeting the 5 types of abuse, which include physical, emotional, medical, sexual, and neglect. Okay, so let's just have a reminder that reporting is the main focus about this comprehension of this material. Sorry. Okay, so this next slide is working with victims of child abuse and maltreatment. You may ask, why is it important that I know this? Who will work with the victims? And I can tell you almost every single person in this room or in our class will have to work with victims someday, sometime throughout their professional career, such as therapists, counselors, dietitians, physical educators, and especially social workers. Types of abuse and maltreatment. These include the 5, which is physical, sexual, verbal, emotional, mental, psychological, and medical. So I will be going into detail with each one of them. Physical is a type of abuse that many people think of when they hear the word abuse. It can include punching, hitting, slapping, kicking, strangling, or physically restraining a child against their will. It can also include making someone feel physically unsafe. Sexual abuse is a little bit I guess, hard to understand. Sexual abuse, it can be a form of physical abuse. We put in the category by itself because it can include both physical and non-physical components. It involves rape or other forced sexual acts or withholding or using a sex weapon. Verbal and emotional. The effect of verbal and emotional abuse are harder to spot and harder to prove. Emotional scars can often take longer to heal. For example, words being used as weapons such as "you are worthless" or "you're good for nothing." Maybe even the phrase of "you're stupid." It really impacts a child when you are letting the child know, or you're calling them names such as stupid. It emotionally can affect a child. Mental and psychological. Mental or psychological abuse happens when one partner or parent, in this case, wears away at the other's sense of mental well-being and health. It involves making the victim doubt about their own sanity. They hesitate to tell anyone about the abuse they are experiencing, or they fear they won't be believed. Medical neglect. Most of us question it as to, oh, really, medical can be neglectful? Yes, it can. It involves parents or legal guardians not meeting the criteria to taking the child to meet their medical needs. So, for example, if a child has asthma and the parents are aware, but the child does not have the medication, then it will be a neglect. Of course, we do take into consideration the family's financial status and how willing the parent or how involving the parent is in the child's medical life. Okay, sexual assault statistics. So as you can see, this picture does demonstrate some statistics depending on the age range, such as from 0 to 4 months of 48.8%, ages 5 through 9, 31.4%, and 19.8 at the ages of 10 to 17%. Some statistics is that 1 out of 14 girls and 1 out of 6 boys are sexually abused by the age of 18. The average length of time that a child is abused for is 4 years, and 40% of victims of sexual assault are children. Of these children, 68% are male Hispanics and are vulnerable. Signs and symptoms of physical abuse, which include red flags such as withdrawal, changes in behavior, depression, and appearance. Withdrawal from friends. Children will start withdrawing from friends or usual activities. So if the child, for example, likes to hang around with friend Georgie and they like to play soccer together, if this abuse is happening at Georgie's house, the child may not want to either be friends with George or maybe distance himself or herself from Georgie, and may not want to play soccer because it reminds them of the abuse. Some other red flags include changes in behavior such as aggression, anger, hostility, or hyperactivity, and it also includes changes in school performance. So that's something to look for our teachers, our educators, our doctors, everyone out there. As I said, we are all one day going to work with these children. Depression, anxiety, or usual fear or a sudden loss of self-confidence is also a red flag that can include symptoms of physical abuse. And obviously an apparent lack of supervision. If you as a teacher, you are part of this child's life for 8 hours a day, you will notice sometimes the child lacks supervision of the parent, and that is a really, really big red flag for us. And the biggest flag is unexplained bruises in various stages of healing or unexplained fractures, abrasions, or other injuries such as burns. It is very important that we look for patterns in injuries such as bites, maybe water submission lines, or anything that we can see. In this picture, the little girl has a bruise in her eye, which is it is very, I guess, it's a red flag that we should automatically question. So next, I will talk about how to identify different patterns when it comes to the physical abuse. We want to look for fingerprints, bite marks, hand marks and slaps, any type of cord or marks or tools used to hurt the child. So as we can see in these pictures, it'll show you what comes from covering the child's mouth with maybe a sheet or forcefully tying the child down. It will leave the bruises besides the mouth. When a child is slapped, you usually will see the typical slap pattern, which will leave the finger marks. Usually there's in between the fingers, they'll leave a white mark, like space in between them. And very hard to believe, parents or the abuser will bite the child in areas where it is not common for us to see, such as this child right here is bitten in his thighs. So those are the biggest patterns to watch out for. Another one that we're not used to seeing may be inside the mouth. Some parents or some children who are maltreated can actually tear their pharyngeum, which is a little skin we have on top of our gum, and that can be from a bottle being forced in their mouth, or another body part being forced into the child's mouth. We'll talk about signs and symptoms of verbal and emotional abuse. So first I would like to share this quote which impacted me. It says, "You can't teach children to behave better by making them feel worse. When children feel better, they behave better." Um, so I will share behavioral changes, speech disorders, developmental delays, lack of attachment to the parents, and extreme passive or aggressive behavior. Some emotional signs and symptoms can be a little bit easier to catch, beside like in regards to physical abuse. The child may show rapid changes of behavior from one day to the next. It is very important to keep out in the lookout for these red flags. Like I said, it is a little bit difficult to see because we're not seeing it with our eyes, but you can definitely tell when the child is emotionally abused or emotionally hurt. Signs and symptoms of mental and psychological abuse. Psychological abuse, though, can be just as devastating as physical abuse. Psychological abuse can affect your inner thoughts and feelings as well as exert control over your life. Psychological abuse can destroy intimate relationships, friendships, and even your own relationship with yourself. Psychological abuse signs and symptoms may start small at first as the abuser tests his waters to see what the other person will continue accepting. But before long, the psychological abuse builds into something that can be frightening to the victim. So this can be name calling, yelling, insulting the person, threatening the person, imitating or mocking a person, swearing at them, ignoring, isolating the person, excluding them from meaningful events or activities. Um, I included this image because it is also very powerful. It shows an innocent child with words such as stupid, dumb, lazy, idiot, good for nothing, and it's just a sign of physical abuse, well written all around her angelic face. Signs and symptoms of medical abuse. Medical abuse, when someone purposely makes a child sick, or like I mentioned before, it is not taking the child to the doctor when the parent or the guardian is in full understanding that he or she needs to go to the doctor. It's requiring medical attention. It puts the child in serious danger or injury and unnecessary medical care. This may be due to mental disorders called fictitious disorders, such as a parent harming the child. So I will go through the list of what I did mention here, such as a child who is diabetic and is not properly meeting the criteria, such as needing their insulin. A child, again, having asthma and he and she did not have an inhaler, unintended medical problems. A parent or caregiver knows that the child needs medical attention and refuses to take the child to the doctor. Another common thing you might see later on is if the parent knows that the child is being abused physically, sexually, and he or she is part of the case, like if he or she is involved with the abuser, they will most likely work with the abuser and will not take the child for checkups to the doctor, even though the child is in danger, because they know that this will be caught and they will be in trouble. Some indicators of neglect are malnutrition, begging for food, stealing or hurrying food, poor hygiene, matted hair, dirty skin or body odor, comments from child that no one is home to provide care, frequent lateness or absence from school, and being constantly tired. Neglect is the most common type of maltreatment. Often we may confuse neglect with abuse or may get confused with neglect and a parent not meeting their child's need. Often neglect is indicated to some families, but it may differ when it comes to financial status. Like I said, sometimes we may think that a child is being neglected, um, but we do have to sometimes talk about the financial status of the family. Such as another example I can give is if the family does not have money to buy this child shoes, to bathe every day, to maybe eat 3 times a day, and situations like that. We do have to take into consideration as long as the parent is trying. Why do all these types of abuse matter? You may ask yourself, why is she going over all 5 types of abuses? Well, I can tell you most of the abuses, such as physical, emotional, verbal, mental, medical, all can play a huge role in a sexual abuse. Um, Perpetrators often seek a person who is being abused or knows that they are not emotionally stable. He or she will then begin to manipulate the child. So they do look for easy target, easy access, and this is why understanding each type of abuse really matters when it comes to unwrapping what sexual abuse really is. So we're going to go into the main detail of child sexual abuse. So child sexual abuse includes um, touching and non-touching activity. I will go over the touching a child's genitals or private parts for sexual pleasure, making a child touch someone else's genitals, play sexual games, or have sex putting objects or body parts like fingers, tongue, or penises inside the vagina, in the mouth, or in the anus. Non-touching activity includes showing pornography to a child, deliberating exposing an adult's genitals to a child, photographing a child in sexual poses, encouraging a child to hear or see sexual acts, inappropriately watching a child undress or use the bathroom. These are the touching activity, including touching a child's genital private parts for sexual pleasure, making a child touch someone else's genitals, play sexual games, or have sex putting objects or body parts inside the vagina, mouth, or in the anus, like I mentioned before. Sexual abuse also includes non-contact sexual acts. So, regression to a young behaviors. These are some of the regressions, to a child sexual abuse case. Um, they might show regression to younger behaviors such as like bedwetting, talking like a baby, changes their eating habits. This abuse causes a lot of loss in appetite or gain in appetite. It depends on how the child reacts to this type of trauma. They might outburst in anger. If they show new vocabulary or use new adult words for body parts, if they're not and from an obvious source. So, for example, if you don't teach your child what a penis is, but you teach them that it is a wee wee, and one day they come in saying, "Oh, my penis," that is a big red flag. If it is not vocabulary that you have showed your child, because they might have learned it or heard it from another source. Self-harm, such as cutting, burning, or other harmful activities. Physical signs are such as unexplained soreness or bruises around the genitals or mouth, sexually transmitted diseases, pregnancies, not wanting to be alone with a particular child or a young person. So if you notice your child distance him or herself from somebody, that is something to really look into. Signs and symptoms of sexual abuse. Um, so basically, the 2 types are criminal sexual contact of a minor, which is CSC. Um, This is the unlawful and intentional touching or applying force to the intimate parts. Criminal suction penetration, CSP, causing the penetration to any extent with any object of the genital or anal openings of another, whether or not there is any emission. So acting out in an appropriate sexual way with toys or objects, nightmares, sleeping patterns, becoming withdrawn or clingy, becoming unusually secretive, regression to young behaviors as we discussed before, unacceptable fear to particular places or people, talk to new friends or unexplained gifts, and physical signs. We will go more into detail about the talk to new friends and unexplained gifts further along in this presentation. So some of the characteristics of sexual abuse experience. The mean age of sexual abuse is the age of 9. Boys have an older victimization onset. Families of both instant and non-instant sexual abuse are less cohesive, more disorganized, and more dysfunctional. Risk factors of sexual abuse are males and females are at increased risk if they live without one of their natural parents, have a mother who is obviously unavailable to take care of them, and view family life as unhappy. Psychological and cognitive vulnerability. So what I mean by this is if a child is unpsychologically stable, or if they have a disability of any way, these individuals are 1.75 times more vulnerable to be sexually abused than children without a disability. Some methods of abuse. So abusers will develop a relationship with the child. In some cases, the abuser occurs without warning. However, in most cases, the relationship will begin to sexualize over time. So the offender will use force, threats, and fear. So threats meaning sending threatful messages, letting the child know, if you tell, this is what I'm gonna do to your family. This is what I'm gonna do to mom. This is what I'm gonna do to um, whoever, to stop the child from actually disclosing, and obviously interpret fear into the child. Okay, so other characteristics of sexual abuse. Um, some victims are known as compliant victims. So these are the victims that will work with the abuser and will do as they are told. So these victims believe that the acts are consensual. This occurs when the offender makes the victim believe that they have true love. So if there is a 25-year-old trying to target a 16-year-old, he or she will make them believe that he truly or she truly loves them, and they will start off by participating to exchange gifts, monies, illicit activities, or experiences. So, hey, if you do this with me or for me, I will take you to Disneyland. I will buy you the expensive iPad that you've been wanting. I will give you money. It is known that most of these victims affected by these type of abusers are teenage girls. They are manipulated by expensive items, trips, toys, and money. Effects on child sexual abuse include shame, self-blame, depression, anxiety, post-traumatic stress disorder, self-esteem issues, sexual dysfunction, and self-injury. These are the most common effects a victim will face throughout their life if they have been a victim of sexual abuse. And as we can see, there is obsession, trauma, disorder, anxiety, pressure, dementia, grief, obsession, a lot of different effects that shows within the shadow of this young teenage girl. Nature of abuse effects. Abuse causes many types of emotions, psychological issues that affect the way a child views themselves and the world around them. Some types being fear and shame, anger and depression. The most likely feel that everything was their fault. They will feel ashamed and embarrassed that this happened to them. After they go through these phases, then anger will take control and they will start feeling angry about the situation. They may feel angry or anger towards themselves, at life, even at God, but mainly and obviously against their abuser. Behavioral problems and sexual behavior. Children who are sexually abused are reported to have more behavior problems by their parents. Behavior problems are not always due to the sexual abuse that may result from exposure to aggression, harsh parenting, but 1 out of 3 of sexually abused children have these problems. So like I said, not all children will live the cycle, meaning that because they were abused as a child, that they will grow up to be an abuser. It is been proven that some victims do become abusers as they grow, but like I said, not all of them turn out like that way. Effects on males and females. So as we can see in our male, we often grow up having difficulty distinguishing among sex, love, nutrients, affection, and abuse. They may not notice when explicit demands are made on them. They've learned to see these as normal and acceptance. On female sexual abuses, females showed deleterious domains such as earlier onset on puberty, cognitive deficits, depression, dissociative symptoms, sexual development, and mental disorder. These effects are commonly seen after the child has grown up and began his or her own life. These are long-term effects that they will have to face later in life as well, and they do have to be treated. Disclosure of a sexual abused child. So most of them do always ask themselves, should I tell, should I not tell? Meaning, do they disclose or do they not disclose? Disclosure is a process and there is multiple reasons for not wanting to disclose. So a child may stop themselves from disclosing due to shame, fear, embarrassment, and denial. It may take time for a victim to disclose about the abuse. It can take hours, days, months, even years sometimes. It is that once that they feel safe and they have overcome most of their obstacles or doubts, is that when they will disclose. Okay, barriers a child must overcome in order to disclose. So this one is very important to comprehend because we must not push the child to disclose. So it is embarrassment and shame, understanding what abuse is, understanding why it would happen, what happens if I tell. So this is cost versus benefit. What if no one believes me? Protect the offender and alleged offender. So what I mean by cost versus benefit is a child will think, okay, so if I do tell mom that dad is abusing me, then they will automatically think of dad. He's a money maker. He's a bread giver. So what will happen to my life if dad goes to jail? That is what I mean by cost versus benefit. And they will protect the offender if it is mom, uncle, grandpa, and this child, they love mom, grandpa, or dad. They will eventually protect them from being prosecuted. Okay, so what to do when a child discloses to you. This one is also very important. First of all, we make sure that we do not panic. It is the most important thing. Always believe the child and do not ask leading questions. Children will have to tell their stories at least 5 times whoever they are disclosing to, law enforcement, forensic interviewer, social worker, and even at court. Disclosures. Never ask leading questions, like I said. Never change the child's words. Do not question the abuser. So you don't go up to the abuser and ask them why they did it. And all adults present during this disclosure or discussion of the abuse must report. So report, most of us might not know how to do this, so you do report this to law enforcement, CYFD, New Mexico Children, Youth, and Family Department. You can also dial #SAVE from a cell phone or the simple number 1-855-33-7233. So let's please memorize this so we know how to report properly. A SANE nurse, quickly let me show you or teach you what this is. So this is a sexual assault nurse examiner. She is an RN. She is the one who decides if there will be a SANE exam, like if there's a SANE exam that will be taking place after the. What happens in the SANE exam unit? The unit is a medical facility. Victim becomes patient. The advocates are present, available to the victim. They provide Plan B, evidence collection, forensic photography. These evidence collection and forensic photography are the most important ones because they do take evidence if they ever have to take this case to court, and they will show this as their main, obviously, evidence. Some protocols is that they're different from 0 to 12 ages. SANE exam can be done if the last contact with the abuser was within 72 hours. The protocol for 13 and older, if the last time that there was contact was within the past 5 days. And the age of consent in New Mexico is 16 for SANE exam, and it is an optional for the victim. So the victim does not have to take this. She may or he may decline the exam. And then the victims do not need the parental consent. The sexual assault evidence kit, this is a kit that the RN, actually the same nurse, she works with in order to collect the evidence, the patient's DNA, and trace fibers. The evidence is sealed and it is sent out after the evidence have been collected, such as DNA, saliva, blood, semen, or hair. The same conclusion, there's a lack of injury does not mean that because there is a lack of injury, that does not mean that sexual assault did not occur. 98% of children cases do not involve injury. Sexual cases do not involve injury. A SANE exam is secondary to the victim's need for medical attention to any physical injuries. So what I'm trying to say is if the child comes into the ER and he has more of a physical and medical need, then we will not focus on the same exam first. He is obviously first, so the same exam becomes secondary. Purchase to treatment. So very good treatments for this would be in-home services, trauma, family therapy approaches, and therapeutic daycare as healing for sexual abuse or any type of abuse, but mainly focusing on the sexual. So reporting is our duty, guys. Remember, if you see it, if you feel it, if you have a gut feeling that something is happening, let's just report. We better be safe than sorry. Let's save little lives out there that we know it how now and that we should. So this is why it's important that most of us know who will be working with these children. So I'm talking to my teachers, my dietitians, my therapists, everyone out there that we are going to the real world now. Let's make sure we are reporting properly, and yeah, let's save some lives and remember that this is your duty. So thank you all for your attention, and I hope you all enjoyed my presentation.